My guest is Dr. A. Holly Johnson, Reedon's advisor and an orthopedic surgeon specializing in foot and ankle surgery at the Hospital for Special Surgery and an assistant professor at Weill Cornell Medical School in New York City. As if that wasn't enough, she's a team physician for USA Women's Ice Hockey, serving at the 2014 Sochi Olympics, and a team physician for the WNBA New York Liberty basketball team. An all-around incredible human, Dr. Johnson has been a trusted advisor on our quest to make the world's most comfortable shoes. Join us as we get into the foot pain epidemic and what makes Reedon shoes so special.
Hi. So I take care of patients from all backgrounds. I also take care of lots of athletes. I also treat everyday people with everyday foot problems. So I see a lot of different complaints about the foot and ankle.
So, Dr. Johnson, according to a survey I saw, 77% of Americans experience foot pain, and 51% say their foot pain has restricted their daily activities. Why is that? Like, what is going on?
I mean, I think there's a few things that contribute to that. Certainly, very obvious factors like people wearing ill fitted shoes, spending lots of time on their feet with shoes that perhaps don't give them enough support, even shoes that are too small. There's actually a great study that was put out by one of my colleagues that showed that a majority of women were wearing shoes that were half a size too small. So I think that shoe wear in and of itself contributes to that a lot. And then in addition to that, especially if you have a job where you're on your feet a good portion of the day, where you are forced to walk or carry heavy objects, all of this can cause increased stresses on the foot that can affect really everyday activities. Roughly a quarter of women have bunions, which is that bump on the inside of their foot where their big toe starts to push in towards the second toe. With the bunion comes lots of other foot pain and ailments. You not only get pain from the bunion itself, which is on the inside of the foot, but often the ball of the foot and the little toes become painful. And what Reedon has done with their insert is they have given some metatarsal support that really can help alleviate some of that pain that's caused by bunions, namely the offloading or the transfer metatarsalgia, we call it transfer of weight to the lesser metatarsals, which causes that ball of the foot pain. In addition, the soft, comfortable leather really accommodates for any type of forefoot deformity. So if you have that bunion sort of protruding and wear in shoes with less comfortable leather, it can be really painful. With Reedon's soft leather, it really accommodates for that bump, and just generally speaking is a much more comfortable high fashion shoe for anybody who has any sort of even mild to moderate foot deformity. So this is not a minor problem just affecting a small percent of the population. And if we can make even a small difference by allowing people to be in more comfortable footwear as they go through their daily activities, doing their jobs, and even enjoying themselves on weekends, I think we can make a real difference here.
Why is arch support so important?
Well, arch support is really important for certain foot types. All people don't need arch support. But if you think about throughout the day, especially even if you're in a job where you're on your feet off and on, the muscles in your feet and the joints, the ligaments, they just get tired. And having that extra bit of support really lengthens the amount of time before the foot fatigues. And if you have a little bit of arch, even just a little bit of arch support, it can help you maintain comfort, without that sort of foot fatigue that we often feel at the end of the day. Now, there are people who absolutely need very specific arch support. Patients with flat feet or fallen arches or tendon problems in their foot. And in those cases, they really may need a more custom arch support. But even with just a little bit of a flat foot, an arch support can often allow you to wear a regular shoe, as opposed to wearing a sneaker or a more orthopedic type shoe.
Mhm. Yeah, that's so true. And this is my personal experience, but I find that when I have actual proper arch support, that it kind of like evens out the balance of my weight on my foot, so not all the pressure is on the ball or the heel of my foot.
Yeah, it's funny. I've never actually thought of it that way, but I think that makes a lot of sense. It just distributes the weight better throughout the foot, so you're not point loading in certain areas. Instead of having a stiffer soled shoe that that allows the foot to rock, which is often a great solution, um, it's not a great stylistic solution. And so by having that arch support and distributing the weight throughout the entire plantar surface of the foot or the bottom of the foot, you negate the need for that rocker bottom type sole.
Right. What are some of the key issues that your patients come to you with, and are you finding that shoes help or don't help, or what are the solutions you're providing to your patients today?
So a lot of my patients come in and they have very specific foot problems. They have pain in the ball of their foot. They have a slightly collapsing arch. Not enough of a problem where they need surgical intervention or they are forced to wear special orthopedic shoes, but where they have everyday foot pain that is easily solvable with some sort of minor adjustment to their shoe. Unfortunately, what's out on the market, either for a custom insert or even an off the shelf insert, is it's really impossible to fit that in a flat or a pump or a wingtip shoe or some or a loafer even. They're just too thick, they make the shoe too small, and generally speaking, it's almost not possible. And so what Reedon has done so nicely is it offers that extra support, cushioning, metatarsal support built into the shoe already. So you're not looking for some sort of external insert to try to jam in and then jam your foot in afterwards. So it combines the support that patients need in one product while keeping, amazing style.
So most of the times with commercially available quote unquote comfort shoes, it's usually achieved by adding additional cushion and a wider toe box. Now, our solution is a little different because, yes, we have cushion, but we also made it very much a priority for us to add this TPU arch support. Can you speak a little bit about why that's unique?
I think what really sets Reedon shoes apart from other shoes on the market that claim to have arch support is that you truly do offer an insert within the shoe. I have yet to try on a non-orthopedic shoe or a non-sneaker type shoe that actually offers metatarsal and arch support. There are a lot of shoe wear companies out there that claim it, but none of them actually do it. And you can simply pick up this shoe and look inside of it, and you'll see the difference. If you pick up a pair of Reedons and you pick up a pair of another competitors who claims that they have arch support, it's very clear what Reedon has over that other shoe. And so I think the real difference is a shoe like Reedon's just doesn't exist and hasn't existed on the market prior to now.
Yes, exactly. I feel the same way. It was like took a while to get here, but 2 years long, baby.
It's amazing. God.
Thank you so
Okay.
much.
See ya.
Bye.
Bye.